Allison. I will be your student nurse today. Can I get your name and birthday? Okay, great. That matches what I have. So Sarah, your physician has ordered an NG tube, nasogastric tube. That will be helping to empty out a lot of those contents of your stomach, which are making you so uncomfortable. So first I will begin by placing you in high Fowler's. I will be assessing your GI status, so that includes passing of flatus, bowel sounds, abdominal distension and girth, last bowel movement, any nausea you may be having. I also want to assess your level of consciousness to make sure that you understand the procedure and what we'll be doing, and hopefully you'll be able to cooperate with us. I want to look at your nares. Sir, have you ever had any facial trauma, surgery, anything? No? Okay, great. So they're intact. All right. All right. Let me put on some gloves. I will be checking to see which nostril we'll be using. And how we will do that is by, I'll be pressing against one nostril. I'm going to have you breathe in and out of the other. Okay, and then now we'll be doing the same to the other. All right, which one did you feel like you breathed out of easier? Your left? Okay, great, cool. So now next what we need to do to measure the length of the NG tube, we will be taking measuring tape. So we will be starting from the tip of his nose to his ear and to the bottom of the xiphoid process. And I get 51 centimeters. And since I touched his face, I would like to change my gloves. I'm going to wash my hands here. Put a fresh pair of gloves on. So I said 51 centimeters. So what we'll do, take a little piece of tape here. So I've got a little piece of tape. Okay, and I've taken this out of my package. All the expiration dates are good. Okay, put that on. Okay, I'm going to stick that back in my package here real quick. I'm going to drape my client. I'm just going to do that because it's going to fall off. So I'm going to drape my client. Okay, and I've got a cup of water, which he will be drinking once I pass the tube past a certain point. I'll be having him take sips of that, so I've got that. Okay. So at this point, I've got my tube, I've got where I need it to go. I've got my lube, because if we don't use lube, it will be very difficult to go down. Okay. And then we also want to make sure that we either have a syringe or our cap, otherwise the contents are going to spill all over the place. Okay, so first I'm going to have him tilt his head back. All right. Okay. And then once it gets essentially to the back of his throat, okay, sir, now I need you to tilt your head forward for me. Okay, and as he's drinking the water, he's taking sips, I'm feeding this down. If it were met with resistance, I could have him tilt his head back, and then I would look to see if the tube was coiled up. If it was coiled up, I would remove it and start over in the other side. But it is not, it is going straight down. Okay. Okay, so his head is forward, he's continuing to sip. Sometimes if the client's coughing, whatever, you can stop for a little bit, help them drink more water. Okay, and so now I've reached my point here. you doing, sir? So I'm trying to get my piece of tape here so I can secure it to the patient's nose. Okay. All right. So that goes right down patient's nose. And then the other two little pieces are just wrapped around the tube. Okay. All right. And then what I want to do next, so I need to confirm placement. Okay. So, I'm going to take the cap off. Okay, I'm going to aspirate a little bit of the contents. Okay. Putting that in there, and then I'm replacing that tube. I'm going to take one of my pH strips. I'm going to test the pH. So the pH of stomach contents should be anywhere from 1.5 to 3.5. All right, let's say it's 2.6. Okay, good. We know we're in the stomach. And then another way to confirm placement is by, okay, we're gonna push in, or instill 10 to 20 milliliters of air. Okay, put my stethoscope in, and we want to hear a whooshing or a swishing. Okay, we're going to put that right over the stomach area. Okay, yep, and I can hear it going in. So that's another way to confirm placement. And then X-ray, of course, is going to be the final way to confirm placement. And if let's see here, if it was indicated that that it seems like I'm in the right place, but I'm not getting any return, even though the pH says, then I would continue going 2 inches further. Okay, so after I've confirmed my placement, I'm going to put it on intermittent suction. So I have my connector here. Okay, we've got that. And then I'm going to secure the tube, if I can get this tape open. Okay, and then I make a little flag, and I put my pin through that flag of tape. And we've got that. And the patient also would have had a tissue that, should he have any spit or anything that he needs to blot his face with, he'll be good for that. We will, like I said, we're going to send him down, or have X-ray come to the room, confirm the placement. I'm going to wash my hands. I'm going to note the COCA of the contents of the stomach, how the patient handled it, what I used, what the pH was, and any other data that I deem necessary. Yeah.